Today, I'll be speaking about some of the common pediatric or orthotic management and neuromuscular disorders. Pediatric orthotics are designed specifically keeping in a mind child's functional need. I think it's not moving. Sorry for the turbulence, guys. So I was just talking about the pediatric orthotics are specifically designed keeping in mind the child's functional need. The custom orthotics are probably the best options, what we usually give to provide more stability. And as the child grows and progresses through the orthotics, it's very important for us as a clinician that we should allow that growth within the same orthotics because these are going to grow, the child outgrows the splints very fast. So we have to make sure that adjustability feature is a very important in there. And it differs from the adult orthotics in few ways. Among the most significant one is that they must account for the rapid growth of the kids because they outgrow very fast. Since the growth theoretically has an advantage by virtue of which there is a possibility of significant correction and abnormality being treated out there. However, even a continual orthotic adjustment don't have the ability to directly influence the bone growth or fix deformities. What's the unique solution we are providing nowadays is actually the 3D assessment and scanning method, which is quite accurate when it comes to taking the measurements compared to the traditional one. Then we shape the orthotics and prosthetics in our CAD/CAM based softwares. And afterwards, we do the printing or CAD/CAM manufacturing, and then we're ready for the delivery. And most important is the post care because we do a lot of follow-up care. We have a prognostic outcome division where we have to list down all the progresses of the child, the follow-ups, and we do have to list that, monitor it, and make a progress note for that. So what's the workflow right now we have is we have the subject, for example, the patient, which is followed by the scanning, utilizing a handheld scanner. It goes into design where our designers do the designing based upon the biomechanical need of the child. Then it goes for the printing or manufacturing, and then it's packed and ready for the delivery and ready for the fitting for the patients. Let me show you what 3D scanning is all about. This is a 3D scanner, what we are talking about. This is one of the finest human body scanner. It's mobile, portable, can be taken anywhere in the sophisticated space. So it captures all the body shapes within minutes sometimes, taking the complex shapes as well to the easiest one. It eliminates the human error and of course does not leave any mess like plaster. These are some of the old school techniques, what we have been following in the past, which was really time consuming. And you can see a volumetric change because of the plaster exothermic reaction, time consuming, human error, cast distortion, of course, the patient discomfort. Imagine the kid over here being for the cranial helmet, for example, it's very difficult for the kid to manage that. On the top of that, we can take the scan within a minute, for example. Let's move on to the lower extremity management. What's the goal we are looking at is the most important thing. As the doctor has mentioned that we have to look onto the functional needs. What's the spasticity? What's the contraction management over there? For example, we use some clinical measures like MTD, modified Tardieu scale or Tardieu scale. And the very important thing is within the spastic patients is R1 and R2, that what's the functional range of motion and what's the passive range of motion you're able to achieve. And we never want to force our patient to go into the R2 category, or else they will always be having problems with the gait ambulation, especially. These are some of the other orthotic management what you're using, for example, in a combination of a static and dynamic A force by utilizing extension spring over there, which actually delays your heel progression and works beautifully well, especially in the case of crouch gait. And it does give you a hydrostatic compression where you can make a dual layer of A force within that's very soft and flexible, adheres to the skin very closely, and it creates a good hydrostatic compression, of course, there. Managing hypotonia, especially with the kids of the Down syndrome, autistic kids, for example, sometimes tiptoe walking. SMOs are one of the finest. What we have seen is a very flexible, thin plastic, customized, works onto stability, allows the flexibility to move around, gives you a bit of a dynamic subtalar pronation as well, for example. It corrects your deformity or the malformation of any body. Some of the other range of ankle foot orthosis, what we do is especially for neurodevelopmental issues, for example, for cerebral palsy, stroke, They are all uniquely engineered to provide support to the proper ankle joint, put an ankle shape there. There are different materials you can scroll through, for example, plastic, carbon fiber as well. These are some other high profile orthotics like knee ankle foot orthosis or hip knee ankle foot orthosis, where we are looking to manage the trunk, where they have got a very weak hip musculature, so truncal musculatures as well. For example, this is the case. I have got it from the web. I wanted to go through that video. For example, this is a case of a cerebral palsy, gross motor functional classification 4 to 5. You can see how beautifully the child is managing with the help of custom orthotics and a mobility aids, which is very important in this particular case. Example. She's being carried out by mother, for example, and then it goes into the TLSO. She uses some custom seating devices as well. So this is like a walking aid, can be positioned together with any custom orthotics. And you can count it, you can monitor it. Example, you can have your summary of gait, how many steps you have taken, what was the knee flexion angle, what was the hip flexion angle, have a proper trunk support. And the ultimate aim is not to actually let them dependent on these devices, but rather just let them come out of this device as soon as possible to strengthen the core muscles as well. Because most of the time patients are not within the facility, it's with the either the family or caretaker, for example. Another one is a Rewalk Exoskeleton, for example. It's a body power system, not suited for pediatric in most of the cases, but good for adult range. Cranial remolding orthotics, again, it's a very important in some of the patients like having a deformational head shapes like plagocephaly, brachycephaly, or even in case where you're looking at craniosynostosis cases where premature fusion of your skull sutures, and post-operatively you can also provide custom-made CAD/CAM designed cranial remolding orthotics. These are all FDA approved products, very safe to be used. It doesn't hamper any of the brain growth in the child, for example. Some of the cranial facts, I would like to just go through that quickly. It's not visible. It does have got the functional limitations as well. For example, that's your lower portion of the cranium and the top portion is the neurocranium. You can see the jawline movement as the head shape changes, for example, there. And the peak height grows upwards there. It's a case of brachycephaly where you have got a center of flat head. This is a plagocephaly where your head shape becomes like a parallelogram. So you can see the jawline rotating around the transverse plane and how it changes the entire symmetry of your inner cranial structure. That's how we do the scanning, for example, I was talking to you about. Let me quickly go through that. This is the software what we're using actually. It's specially designed to acquire any of the head body shape. We are trying to take the scan of the cranial, for example, over here. And it's resistant to the movement as well, for example. So even if the kid is moving quite a lot, it still captures the images and it gives you the real-time data, for example, and you can pull out the craniometry report, which gives your volumetric management, your arithmetic management, everything within few minutes. Imagine the same thing happening with the help of plaster. That's actually very messy and not that comfortable for your kid so early age. So that's how we do the 3D measurement. These are the protective helmets, for example, especially in the case of cerebral palsy, where the patients are having a feature of head banging. You can actually customize 3D printed, not a 3D printed, but rather any sort of flexible materials as well over here. These are the scoliosis braces. What we do, for example, corrective scoliosis braces. That's the functional classification what we use, ALS. And these are the soft corset for patients who cannot tolerate the rigid bracing, for example. That's the seating system, what we have. These are the positional seating standard, vertical standards, what we use within our facility, for example. These are some of the case studies, what we have done with the positional chairs and walkers, gait trainers, vertical standards, and standing. These are some of the upper extremity orthotic rehabilitation with the hand splints and braces, managing contracture, spasticity. Thank you so much.